Hello, and welcome to Advancing Equity, a Racial Equity Journey. We are thrilled to be teaming up with the Government Alliance on Race and Equity, or GARE, for today's webinar. GARE is a national network of government jurisdictions working to achieve racial equity and to advance opportunities for all. It is a joint project of Race Forward and the Haas Institute for a Fair and Inclusive Society. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. This program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. My name is Karen Odegaard, and I am an action learning coach based here in Madison, Wisconsin. And we have a great team for you today. So I want to take a moment to introduce the facilitators and guests for today's webinar. We're going to stop sharing slides for just a moment and share our videos. So I'm going to ask all my colleagues to turn on their videos, and we're going to stop sharing slides for a moment. Hey, everybody. So let me start by introducing our friend from GARE. Shauna Davey is the South and East Regional Project Manager, and she is based in Atlanta, Georgia. Welcome, Shauna. Oh, we'll practice with muting and unmuting as we say hello to everybody. There we go.
Thanks for having me, Karen. Really appreciate it.
Thanks, Shauna. From the County Health Rankings and Roadmaps team, I am joined by fellow action learning coaches, Allie Havrilla in Smithsburg, Maryland. Hey, Allie.
Hey, Karen. Hello, everyone. Glad to be here.
And we also have Raquel Bornanesk in Portland, Oregon.
Hi, everyone. So glad to be here.
Great, thanks. Raquel will be chatting with you today, so watch the chat for her. And Allie will also be helping us with the Q&A. So as you put questions into the Q&A box, Allie will be reading those and making sure that we get to as many as we can during our Q&A session. I also want to acknowledge our technologist, James Lloyd, who is based here in Madison with me. James,
Hi.
awesome. Problems, just reach out to him. Thanks, James. And then I'll also give a shout out to our fellow coach, Erica Burrows-Girardi, who is in Florida. Hey, Erica.
Hey, and I'll be facilitating the discussion group with you today.
Yeah, thanks. I also want to take a moment here at the top to make sure that we introduce you to our two guests. Helene Dewey and Rowena Pinata are joining us from Spokane County. Hey, ladies.
Hi, thanks for having us.
Yeah, we are excited to have Helene and Rowena with us. They co-lead the Spokane Regional Health District Center for Equity, which was launched just this year. And both of them have been engaged in their agency's equity efforts for the past 9 years. So we are so excited that you can be with us today.
Thanks for having us.
Yeah. All right, so I'm going to go back to sharing my screen. All right, great. So we are excited for today's webinar and want to share what you can expect to leave with. Today's webinar will allow you to compare Spokane's racial equity journey to your own community's journey. You'll be able to describe why addressing racial equity matters to health, and you'll be introduced to tools or resources that you can apply in your own community. I also want to invite you to join me and our guests after the webinar to further explore these topics and engage in conversation with each other. Immediately following this webinar, we will offer an interactive discussion group to deepen your learning. These conversations give you the chance to be face-to-face with other webinar attendees and to share what you are doing locally, as well as ask questions of other participants. We are pleased to be able to offer these sessions in partnership with Healthy Places by Design, Joanne Lee. Healthy Places by Design's Joanne Lee, and she will be our lead facilitator along with Erica for that discussion after the webinar. So you can watch the chat for details about how to connect later in the webinar, and Raquel will be sending that information. The County Health Rankings and Roadmaps program has helped to broaden the conversation about health and what influences health. This short video introduces the model behind the County Health Rankings. So let's take a look.
We all have a role to play in shaping our community's health. There are so many factors that influence how long we live and how well we live. Think of all the things that affect our health. Sure, we could all eat better, move more, and make sure we get our annual checkups. But there's more to it than that. The quality of our homes, the safety of our neighborhoods, and our chance at a good education all influence health in the short and long term. But how can we understand how all these things fit together? Meet the County Health Rankings model. The model illustrates a broad vision for health. The model shows us that policies and programs play an important role in influencing the health factors that, in turn, shape a community's health outcomes. That means not just how long we live, but also how well we live. Health is complex. The County Health Rankings model helps us see all the factors that impact health and understand where we can take action so everyone thrives. Visit countyhealthrankings.org to get started.
By ranking the health of nearly every county in the nation, the County Health Rankings helps communities understand what influences the health of residents and to identify challenges and opportunities to improve these outcomes for all. We do this for two primary reasons. The first is to improve health outcomes for all. This includes both how long people live and how healthy they are. Our second goal is to close the health gaps between those with the most and least opportunities for good health. Closing those gaps requires us to advance health equity. Health equity is the notion that everyone has a fair and just opportunity to be healthy. And I want you to notice that health equity requires action. We must remove the obstacles to health, such as poverty and discrimination, while also creating access to good jobs with fair pay, to quality education and housing, to safe environments and quality health care for everyone. If you want to improve health outcomes, then we must take steps to advance health equity. We're excited to be partnering with the Government Alliance on Race and Equity today. GARE plays an important role in helping government jurisdictions to improve outcomes by focusing on racial equity. Shauna, thank you so much for being with us. Can you help us learn a little bit more about GARE?
Thanks so much, Karen. It is a pleasure to be with you all today. And as Karen mentioned, I work at Race Forward on the Government Alliance for Race and Equity, and in a previous position worked at the Robert Wood Johnson Foundation and became just really excited about the great work that County Health Rankings is doing, and especially excited for that new video that shows folks exactly how to think about the model. And the Government Alliance on Race and Equity is a national network of government jurisdictions, city, county, state jurisdictions that are committed to advancing racial equity. When I left RWJF and began working for Race Forward in 2017, GARE had about 39 members. So in just a few short years, we've grown to 178 member jurisdictions that are committed to advancing racial equity. We really focus on not just providing training to government jurisdictions, but really ensuring that we're helping jurisdictions to take theory and put it into action. How do you actually make things work at the government level? So in the next slide, this is just a depiction of where we are currently, and I mentioned that we're growing pretty rapidly. We're really excited to see so many jurisdictions who are focusing on this issue and who are diving deep into looking at how their historical policies, practices, and procedures have led to racial inequities in their communities, and what are some of the ways that they can change those policies, practices, and procedures to improve outcomes for all people, including people of color. In the following slide, GARE really thinks that it's critical to express to folks why we lead with race. Sometimes we're asked to come in and share a little bit about equity, and folks may even say, hey, we want you to talk about equity, but not about racial equity. And we say, as county health rankings, we don't believe that we can discuss equity without actually talking about race. In fact, so many of the indicators that you can view on County Health Rankings website will show you the disparities that we see across many indicators. So we know within the public health world that racial inequities are deep and pervasive. They impact everything from birth outcomes to life expectancy. We also know that many people experience a level of anxiety when they are having conversations about race, and that can cause them to feel paralyzed and not discuss issues related to race. And we don't think that we can solve something if we can't have a conversation about it. So we believe that it's critical that we lead discussions about race so that we can actually get to solutions. We also recognize that learning an institutional and structural approach to institutional and structural racism gives us an understanding of frameworks that we might use and apply to other forms of marginalization and oppression, such as sexism, heterosexism, classism, ageism, and the like. In that same notion, we also understand that we cannot use the same strategies for those types of marginalization. So we would never apply the same strategy for sexism to ageism. We would never apply a strategy for ableism to classism. They just won't work. So we believe it's critical to incorporate specificity as we're developing our strategies. And we believe that it's important to have an intersectional approach. So we see ourselves as not race exclusive, but race focused. And we've learned quite a bit. We've learned from many jurisdictions across the country, including our partners in Spokane, who you are going to hear a little bit from later. And part of what we've learned is that there is some best practice, there is some national practice that can be applied here. And the first for us is about normalizing the conversation about race. So ensuring that we're starting the conversation from the same place. If some of us come onto the webinar thinking we're going to discuss individual acts of bigotry, and others come onto the webinar thinking we're going to discuss policy, practice, and procedure, institutional racism, we'll be having two completely different conversations. And so we want to level set by providing definitions and ensuring that we have that common language from the forefront. Organizing for us is not just about what happens with and in community, but it's also about what is happening within institutions. So are we thinking about where are our racial equity champions within our organizations? Who is interested in moving this work forward? Where are the levers for change? Where's the low-hanging fruit, so to speak, that will help us to change our infrastructure and help us to think about how we might do things differently? This includes possibly the hiring of staff. It may include identifying additional resources to support training for staff. All of those things are a part of development of that infrastructure to sustain racial equity work over the long haul. And then in operationalizing, we believe that it's critical to use data to inform our strategies, and that we can use things like a racial equity tool to help us understand who is experiencing a burden, who is benefiting, and what might be the unintended consequences of a potential policy, practice, or procedure. And finally, we believe that it is critical to have a vision. So visualize is the center of this practice. We believe that it's important for each and every one of us in our spaces and places to consider, what does an equitable community look like for us in Spokane or in Atlanta or in Red Wing, Minnesota? What does an equitable community look like in those places?
Thanks, Shauna. I just want to note that I so much appreciate how you walk through those best practices, and we actually wanted to launch a poll here that I'm going to put up now, because we'd love to hear from all of you which practices that Shauna just walked through, that normalize, organizing, operationalizing, do you feel like you're doing well? And where do you feel like you could use some support? So we'll give you all just a little bit of time to fill that out, and then we'll share the results with everyone so you can all see where folks are at with that. Shauna, I'm curious, as you see folks joining GARE, do you see people maybe really like doing well in one of those areas but needing growth in the others, or how do you see people coming into GARE in those practicing those practices?
Sure, I think it depends. There are many organizations, especially those that have strong health departments, where they are data strong. Yeah. And they have their data together, but they're having difficulty actually having a conversation about race across all of the departments within the organization or within the jurisdiction. And so they really need to think about, well, where do we actually begin and how can we have that discussion? There are others who have begun to normalize the conversation. They're bringing groups in to help them with training. They are putting it on the agenda with senior leadership to talk about it, but they don't have the resources in place. They don't have an office of equity. They don't have budget for training and for implementation of the strategies that folks have come up with. So it really depends, but it's really important that we think about all three.
Yeah. Well, and we can see where folks are at here, that feeling a little more strength, I think, around normalizing, and then and also expressing a need for some additional support around operationalizing. And one of the things that you just shared, I think, is such a strength of GARE and the network that you have created, is that people, the communities that are part of GARE, can learn from each other and build off of each other's strengths. So if you've got folks who are coming in who are strong in operationalizing because they are data driven, then they can help to share those best practices with others who maybe are more comfortable in that normalizing space. So
that's absolutely right. And we even have infrastructure within the GARE network through membership calls, annual meetings, subject area groups, and even some of our CEO groups to help people come together and share that insight.
Yeah. And I'll just note that there's a little bit of chatter in the poll about, a little bit of chatter about the poll in the chat box. About folks feeling like, oh, I don't really feel like I can check a box in one of those areas of strength, one of those practices that I'm doing well. And so I hope that today's webinar and discussion will help you feel like you've got some grounding in some of these best practices of normalizing, organizing, and operationalizing, and that you'll find some inspiration from the story that we hear from Spokane. So Shauna, thank you so much for being here and for helping us put this webinar together.
Excited to be on. Thank you.
Yeah. And let's turn now to our guests from Spokane. I want to bring Rowena Pineda and Helene Dewey from the Spokane Regional Health District back on. Hey, ladies. To hear more about how they've been using the GARE network to address racial equity. And I also want to note that Spokane County, Washington was a 2014 winner of the Robert Wood Johnson Foundation Culture of Health Prize. And we will include a link to their story in a webinar resource guide. You can watch for that resource guide in your follow-up email later this week. So welcome. To start, can you tell us just a little bit about Spokane and your work with the Regional Health District?
Sure, yeah. So just to give you a little idea about where Spokane is, we are the largest city east of the Cascades in Washington State. So on the other side, opposite of Seattle and Olympia. The Spokane Regional Health District is one of 34 local public health departments that serves our state's 39 counties. Our agency was originally established as the Spokane County Health District in January 1970, when the city of Spokane and Spokane County merged both of their health departments. But in 1994, the official name was changed to Spokane Regional Health District to reflect the increased scope of public health services and our geographic coverage. Our agency has about 250 employees, and we serve a population of more than 500,000 in Spokane County. Just to give you an idea about our population, so it is a little over 500,000, and the demographic breakdown is that you can see from the pie chart that we are about 84% of our population are white. We have a growing Hispanic Latinx population at 6%. 4% of our population identify as multi-race. 3% are Asian Pacific Islander. 2% are African American. And 1% are Native American Alaska Native. And I want to note too that we're seeing a demographic change here in our community. Just to give you an idea about that change, we are becoming a more diverse community. Spokane Public Schools, our Spokane Public School District, currently has about 30% of our students who identify as students of color. So we're seeing a little bit of a shift.
So in the next slide, we just want to talk about how we started our journey on health equity. It was about, between 9 to 10 years ago. And you saw the previous slide, which has 84% predominantly white community. And so we've been told on a number of occasions that Spokane County doesn't really have a health equity issue. After all, we're predominantly white. Interestingly, though, when we dig deeper as to why this is the case, we surface a history of racist policies and practices that resulted in the demographics of the community being the way it is. And so we are on the ancestral lands of the Spokane tribe. And so the first item on our history, of course, is to recognize that when the Spokane tribe was moved from here to the reservations, that displacement benefited white settlers. And so that's a piece of history that we have to acknowledge. African-American pioneers in Spokane came in the late 1800s, but faced discrimination and limited opportunities. We still have about 2% African-Americans in Spokane, but it hasn't really grown, again, because there are limited opportunities that exist. And then we have the Chinese who worked on railroads, but the Chinese Exclusion Act of 1882 limited their ability to settle here. So when we look back at the history of racial inequities in our community, we uncovered that these various policies, like the ones I just shared, that explicitly disadvantage communities of color. In addition, in the 1940s and 50s, our community suffered from redlining, just like many communities in the country. And so with redlining, we saw parts of our city having limited investment. And those parts of the city are predominantly communities of color. And that lack of investment continued to reverberate today, especially in the health outcomes of those particular communities. But one history that we want to just talk a little bit today is the building of the I-90 freeway, which was seen as progress. But the building of the I-90 freeway went through the heart of what we call the East Central neighborhood of Spokane, which at the time was the most diverse neighborhood in the city. This was a pattern that was repeated throughout the country. So a few years ago, the Spokane Regional Health District did an oral history project that focused on the devastating impact of the I-90 freeway on the East Central neighborhood. So in the next slide, we'll play a short clip of Theo Adams, who's an African-American resident in Spokane. She's been here for 40 years, and she actually talks about what it means to be an African-American settling in Spokane during that time period.
So when you say your earliest memories were prejudice, do you have any examples of that and how you saw it?
Well, if you went in a place, they just they would either ask you to leave, and that was, after I found my way around town, this thing, and it was just the attitude that you got. Yeah, but it's still around. When we moved here in this house, the people put a petition up because they didn't want us up here. And that, like I said, that's been years ago, but I mean, they couldn't stop us from moving in. We was buying. It's not like we were renting. And although they had a black couple that had been here for years, and they had a black couple on the corner across the street. And here we come in, they didn't want me here, I guess, but they couldn't stop it. So here we're still here.
Thank you, Karen, for playing that short audio clip from Theo. So what we did with this project, and currently we are also working on a history project for SRHD. This is part of an assignment that we have being part of the GARE cohort for the Northwest area of the country, is that doing our history of racial inequities in Spokane really grounded us on policies that existed here that disproportionately impacted communities of color. It also allowed us to change the narrative of our county's history and made it more complex and inclusive of other people.
Thanks, Rowena. And just one thing I wanted to point out, I think when we were putting this webinar together, one of the things that you all shared was that as you have shared some of the history that you have uncovered and put together about the racial history in Spokane, as you've shared that with elected officials and leaders throughout the county, that people have been surprised by the history that they didn't know about. So this is not just rehashing old news that everybody is aware of. It is actually raising consciousness and covering histories that people don't have awareness of. So I just wanted to call that out.
Great. Yeah.
When you talk about the health district's work on equity as a journey, can you just tell us a little bit about what that means to you, about being on this journey and how you started on this journey?
Sure. So this journey, I always like to consider it more of a marathon than a sprint. It started for us as an agency a little over 10 years ago as part of our strategic plan, 3 strategic plans ago. And so what we did bits and pieces of equity work here and there. We developed a website, kind of some of that normalizing, I guess, when we think about GARE's framework. Different programs in our agency started to incorporate health equity in the work that they were doing. Our Neighborhoods Matter program focused a lot more on community engagement. They were also the folks that did the video that you just saw. And in 2012, our data center, great data center, came out with a report called Odds Against Tomorrow, Health Inequities in Spokane County. And this was championed by Adrian Dominguez, who was part of our data center at that time, to bring the issue to surface this issue and open discussions around about privilege. And it was our first external report that really looked at the health disparities within our community. It looked at the disparities within education, household income, race, ethnicity, and place and neighborhood, so the places that we live.
Had to find my unmute. So can you tell us a little bit about how folks responded to that report? It sounds like it was a really meaty and interesting report. How did the community respond?
You know, the community responded in a way that action was needed. And I think that's something as an agency we weren't quite prepared for at the time. Health inequities are personal. They're personal to us as public health professionals, and they're personal to the folks that are most impacted. It's personal to me. I'm Native American. I'm an enrolled member of the Turtle Mountain Band of Chippewa Indians and Sante Sioux on my mom's side. Grew up on a reservation, and so I saw myself in this data as well. And so it really provided us with the lesson that we needed to be working from not just the head providing the data, but from the heart as well. And that when we talk to communities about this data, to do it in a way that also shares their story about why, and provides that narrative about why, and the context about why these disparities are happening. And that's especially true for life expectancy in our community. So this slide shows all the various neighborhoods that we have in the Spokane community. And when we looked at life expectancy by neighborhood, we saw disparities, and in some cases, 18 years in difference in neighborhoods that are just a mile from each other. And so we're seeing it by geography, but we're seeing it from by race as well, the disparities based on race. And so this helped us and other agencies determine areas of focus and to start implementing programs. It provided that sense of urgency, again, that normalizing that Shauna talked about in GARE's framework.
And just to add, Karen, so in this particular data set, the difference between the poorest neighborhood, which is Riverside, and Southgate, which is a relatively wealthy neighborhood, is about 18 years. So we do have more current data, and the gap has narrowed a little bit, but not by much. It's now 15-year difference in life expectancy between those two neighborhoods.
Great. I think one of the things that you've called out here that I just want to reiterate is that when you look at, you can see here in this graphic that Spokane's life expectancy increased, right, from this first time period to the second time period. And so when you started to look at this by neighborhood, you could say, yeah, sure, countywide our life expectancy increased. But what's masked in that is that there are disparities in the neighborhoods and among racial and ethnic groups. So I think this is a really helpful way of looking at the data in a way that breaks it down a little bit to see where those disparities exist.
Mm-hmm.
So when you talk about your equity work, you talk explicitly about racial equity. Can you tell us a little bit about what that means to you and why it's important to talk about racial equity as opposed to health equity more broadly?
I think when we started 10 years ago, as Helene mentioned, we actually did talk about it more from health equity perspective than racial equity. We were fortunate that we got a grant from the Kresge Foundation through its Emerging Leaders program. And that grant helped allowed us to work with human impact partners. And that work started our focus on racial equity. And that focus has been reinforced by our involvement with GARE. So as Shauna mentioned, we want race to be explicit in the work, but it's not necessarily exclusive to race. And the reason we want to elevate race is, as we mentioned earlier in that Odds Against Tomorrow report, the disparities based on race are happening in all sectors. So in that report, when we looked at chronic diseases and cancer rates and life expectancy between population, our communities of color are always disproportionately impacted. And so if we don't name race and racism in that, then we're missing the root cause of the problem. And we're, basically what we're doing is addressing the surface issue, but we're not going deep enough. And so we also, during this journey that we're in, realize that racism operates at the individual, institutional, and structural levels. And again, this is our work with both the human impact partners and with GARE, again, reinforce that for us. And so when we present our work to the broader community, we're pretty upfront that what we're addressing are institutional and structural racism, because that's the only way that we can truly make a change and impact the existing disparities that exist.
Rowena, I wonder if we can pause there for a moment and sort of take that apart a bit. When you're talking about racism operating at individual, institutional, and structural levels, what do we mean? What does that mean? Let's kind of take a minute on that.
Sure. So individual racism is really what we see all the time. It's the one that we mostly focus on. It's usually one individual doing something racist to another individual. And not that we shouldn't address that. I think it's important to address that. And we address it primarily through the individual journey that each of us as staff are taking. But the work that we're focusing on for the health district is institutional racism, because we ourselves are an institution, the health department is. So we have policies, practices, and procedures that disadvantage others and advantages others. And we have to not just be aware of that, but be actually very open that that's what we do, because we're government and we're an institution. It's kind of permeates our system, and that's where structural racism really comes in. Is that not only are we part of, an institution, a government agency, we are part of a larger structure. So we connect the work that we do, connect with the work that education does, and connect with criminal justice. We're not in isolation. And so our practices impact the practices of other systems. So the way the way we've described this is, and we actually use the groundwater metaphor, which is a metaphor that we were introduced to when we did a fellowship with Health Equity Awakened. And the metaphor itself was developed by a group called the Racial Equity Institute. And the metaphor is like this. It's like let's say we're all by a lake and we're checking, we're relaxing by a lake, and one fish pops up the water and it's dead. And we're like, oh, look at that fish. Isn't it sad that it's dead? Now, if we're still sitting there relaxing and all of a sudden half an hour later, half the fish in the lake turns up dead, then we're like, oh, what is going on? And the question we're asking is, what's wrong with the water in the lake that is creating all the, that's killing all the fish? And so in an institutional example, when we look at a school let's look at one school. When a child fails in a school, we usually say, well, there must be something wrong with that child, or the parent is not doing a good enough job in helping the child succeed in school. But when half the students in a particular school fail, the question is no longer about the specific child or the parents. It becomes what's wrong with the school that half the kids are failing. Now, let's go back to the lake example. If you have, like, if you're in front of, 100 lakes and half the fish in all of those lakes turn up dead, then the question we ask is, what's wrong with the groundwater, right? Because all those lakes, the water is coming from the groundwater. And so when we look at different systems, and whether it's education, whether it's healthcare, criminal justice, housing, and what we're seeing is people of color are being disproportionately impacted, then we need to start asking, there's a structural issue that's involved, and what is going on, that our structures are failing members of communities of color. So that's kind of how we look at the institutional racism and structural racism piece.
I think that's so helpful. I really appreciate you taking a minute to break that down. You all began working with GARE in 2018, and I know that there's been a lot of work that's led to that. How has your work evolved since you started working with GARE?
When we started working with GARE, they really enhanced our knowledge and skills as a government entity on how to address inequities. This is one quote that we got from one of our GARE meetings that really resonated with us, and it's, "We are either working on racial equity or we are doing harm." And I think that's really important to remember as professionals, as public health professionals, as government officials, that a lot of these inequities we may not have been a part of, but we have a level of responsibility, right, to mitigate them and to ensure that they're not continuing, and to put those policies into practices into place to ensure that doesn't happen. Working with GARE helped us to focus on racial equity, and achieving racial equity means that race can no longer be used to predict life outcomes, and outcomes for all groups are improved. We are race explicit, but we're not race exclusive, like Rowena had mentioned. And even though our population is majority white, people of color are still disproportionately impacted by poor health outcomes, and we have the data to prove that.
It sounds like throughout your journey, you've learned quite a lot about how you can be advancing racial equity in Spokane. What advice would you have for other communities or other governmental jurisdictions that are trying to start or continue their own equity journey?
Sure. The first one I think we've mentioned earlier is that it's important to have a head and heart approach. This is something that we've learned over time and learned how important it is. We are public health. Sometimes we're data driven and we forget that there are stories behind that data, that there are people behind that data. And Helene mentioned how, as a Native American woman, just the data around the disparities in health that came out in Odds Against Tomorrow hit her in a very personal way. And that's how data lands with people. And we need to be able to engage people from that perspective. We need to build relationships with our communities. And it's hard to do that when you're only coming from the head perspective.
And the next one would be definitely patience. We've been working on this for about 10 years in our agency, and really intentionally a lot more the last year and a half. And it requires a lot of patience, a lot of grit. And we're a government entity, we're a jurisdiction, and so things definitely take time. And getting our house in order to address inequities definitely takes time. So patience is definitely key.
Lean into discomfort. The work on racial equity is uncomfortable. Discussions about race is uncomfortable. but we need to address it. I think Shauna mentioned earlier in her thing that specificity matters, and putting race, being explicit about it is important. It's uncomfortable for sure, but if we don't address what she said is the elephant in the room, then we're not really going to move forward.
And when we start talking about race, I think we have to expect pushback. It's going to happen, and there's always going to be people to say that it doesn't apply to us, especially here in Spokane because we're primarily white. But the data doesn't show us that, and I think expecting that pushback is important. It's very similar to the lean into discomfort. We did a survey, we did an all staff about a year ago, and the number one thing that people said in that all staff around racial equity was that it was uncomfortable. And we considered that success.
Dig deeper into data. We need, even though we have a small number of communities of color, we need to still disaggregate the data. And sometimes we need to look at other ways to collect data outside of the quantitative. How do we do qualitative data gathering? So those are things that we learned over time.
And know your racial history. And again, this is a GARE homework piece for us, but it has been very eye-opening. If you want to know why there's health disparities in your community, understand the inequities that caused them. And so knowing your racial history is really important, specific to your community. And again, we didn't create these inequities, but we have a responsibility to ensure it doesn't happen again.
Great. And we had asked, Raquel put in the chat earlier, we'd asked what questions you all might have about your community's racial history, or what observations you might have about your racial history. And so I want to invite Raquel. Raquel, I don't know if I know I can see out of the corner of my eye that the chat has been moving. But Raquel,
Yes.
have there been any insights there about the history question, the racial history question, just to kind of focus on that for a moment?
Yes, thanks for asking. So one participant chatted about the history of segregation in their community. I think they wanted to know, more deeply about that. And they also pointed out that it's had resulting inequities. Another talked about the history of lynching in their community, and they were aware of an exact count, which kind of made me think that maybe they were aware that the number is increasing because of the continued research, the kind of uncovering of our history that we still need to do in so many places. And lastly, I guess I'd share, there was another participant that pointed out that historically the population counts there didn't include the Native American population. And so there was some awareness about that. So yes, the chat's been really busy. So I'm very thankful that everyone's being really interactive and really engaged with these amazing speakers.
Yeah, thanks, Raquel. I appreciate that. We have one last question for you before we go into our Q&A portion. And that's just, Rowena and Helene, what resources have you used to support your journey?
We've, of course, grateful to GARE for their racial equity toolkit. And as I mentioned earlier, we're part of GARE's Northwest cohort. And so that has been a great resource for us and for connecting us with different governmental jurisdictions in the state and in Oregon. We mentioned Human Impact Partners Health Equity Guide earlier, and that's a framework that we use. And we're also, Helene and I did a fellowship through HIP's Health Equity Awakened, and that has been really impactful for us in the work that we're currently doing. We utilize the Bay Area Regional Health Inequities Initiatives organizational self-assessment toolkit earlier on, about 2 years ago. after we got the grant from Kresge, we did an assessment of our staff and where they are around health equity, actually more so than racial equity, just to give us a sense of where they are. And this assessment also included partners in the community. Now, speaking of partners, we of course are thankful for Kresge's Emerging Leaders program and that grant funding that really got us moving much faster than we have in the 8 years before that. And so we have several local partners here, including Accelerate Success, which is a local nonprofit, our local accountable community of health called Better Health Together. We have been in conversations with one of our hospitals around the work that they're doing on equity. And then of course, we have our guidance from GARE, and again, connection to other governmental jurisdictions that really help us move our work forward. Do you have anything else? No?
All right, well, thank you so much, Rowena and Helene. We're gonna have you stick around. We're gonna come back for some questions in a little bit. But before we do that, I just wanna take a couple of moments to highlight how you all can make the most out of County Health Rankings and Roadmaps resources. So we work with communities in a variety of ways. Specifically, we provide data to reveal the factors that influence health, evidence to highlight strategies that work, and guidance to help communities put the data and the strategies into action. We also work to gather and share stories of communities around the country, like we've done today here with Spokane's. So you can learn from other communities that are at different points in their journey and see some examples and feel inspired by what you're seeing from other communities. I wanted to highlight two key things. One is that we provide data snapshots for nearly every county in the country. And if you have not yet looked at your County Health Rankings data, I would encourage you to go to countyhealthrankings.org and put in your county name. And there you will find more than 30 measures to help you understand what influences health in your community. And 13 of those measures are broken down by race and ethnicity. So you can click on those measures to see how they break down, how they disaggregate. We also want to point out a couple of resources in our guidance that could be useful. We are proud to be launching a new resource called Action Learning Guides. These are an online suite of interactive guides that you can work through at your own pace. The Action Learning Guides blend guidance, tools, and hands-on activity to help communities deepen their knowledge and begin to build skills around specific topic areas. In these guides, you'll find things like easy to follow guidance to help you and your partners develop a deeper understanding of the topic. You'll find questions for discussion and reflection so that you and your partners can apply the learning as you go. You'll also find opportunities to practice with a few key tools to help you put what you learn into action, and downloadable worksheets that you can track your progress and reflect on your own community's experience as you go. These guides were created by our team of Action Learning coaches based on our experience working with communities. In particular, I want to highlight 3 Action Learning guides that are related to advancing equity. These guides provide a starting point for you and your partners to get grounded in a topic, and they can help ensure that, to Shauna's point earlier, to ensure that you're speaking the same language, that you have a common understanding of why this work is important for improving health. So you will find links to the Action Learning Guides in the slides, as well as in the resource document that we'll be sharing later this week. And in just a moment, hey, Allie, you want to take it from here?
Yeah, I was having a problem finding my mute. Sorry about that.
Right. It's always tricky.
Yep, so we're going to switch to our Q&A here in just a minute, but we also want to hear from you. So, and hear your thoughts on today's webinar. So Raquel is sharing a link to a brief evaluation, and I can promise you it is brief. So it would be awesome if you would click on that link and then share your evaluation after the webinar. We use that feedback to just help with our continuous improvement process. And so thanks in advance for sharing your thoughts. And with that, I'm going to click into questions, and we've had so many great questions, more than we will probably have time to get to today. And I might build off one that was shared via the registration and then certainly also came up during the conversation today. And I think it's thinking about the best practices that were offered and sort of under the normalizing, how should we go about getting started with this work, and then specifically in rural communities, and I'm looking for the exact language because I thought it was lifted up well. How do we approach the topic of equity and race and work towards equity within communities where ideologies are perhaps more conservative and there's sensitivity to the words race and privilege? What guidance might we offer? Several folks were lifting that up.
Rowena, Helene, Shauna, I think all of you might have some insights to share here.
Well, you know, I would say one of the, if you look at GARE's framework, that normalizing, I think providing the definitions and starting the conversation, if there's data available for the communities to start looking at disaggregating that data and providing that story, which again is providing the context in which that data, those disparities are happening, and not in a way that questions, right? It's the idea of sharing the data and providing the narrative to it, because if we do not provide that narrative, communities will provide a narrative to it themselves, and that dominant narrative has not helped us out, right? So providing the context, the racial history is important.
Helene spoke to that beautifully, and I know that they have their share of communities that, you know, may have had some pushback in Spokane. I certainly can speak to that, serving the South in particular, and we'll just offer that it's really critical for us to focus first on the visualization. What is it that we want for our community, and have we articulated that we want everyone in our community to be healthy? We want everyone in our community to have affordable and safe housing. We want everyone in our community to have safe and quality drinking water. So starting with that, and then being able to say, here's who's not experiencing that right now. And we need your help making sure that all of us in our community are experiencing those things. So that is actually a framework that we use within some of our processes and workshops called ACT, Affirm, Counter, and Transform. And it's really speaking to what Rowena and Helene talked about earlier. What's the heart part? What is the piece that connects us to one another? All of us are interconnected. We all are in relationship with one another, whether we like it or not. And so we have a shared fate. And it's really critical that we think about that shared fate, even as we begin to have tougher conversations. And I would say start with folks that you do have relationship with, right? And bring those folks on board. In our workshops, we also talk about tipping point theory, and how it's important for us to not try to win every single person over, but how can we think about champions for change, and how can we think about you know, a specific set of folks that we need to have on board in order to move things forward.
Great. Thank you guys for leaning into that question and providing some insights. So appreciate it. With that, Karen, I think I'm going to turn it back over to you to walk us through sort of our next steps and an invitation to join the discussion group.
Yeah, thank you. Wow, that was just a really powerful question and answer, and I know it was brief, and so we want to let you know that there is a way that you can continue to explore this conversation. As we wrap up today's webinar, we want to once again invite you to join us to further explore these topics and engage in conversation with each other. You've been doing it in the chat, and we encourage you to come in and do it in a virtual setting where you can be face-to-face with each other, and we can share what you're doing locally as well as ask questions of others. So Raquel is going to chat out, I think she already has, chatted out the discussion group link. And when you click on this link, you will get a few quick questions, things like your name, your email, where you're from, and then you'll receive another link that will allow you to connect into this live session. And we look forward to seeing you there. To help us kind of get started with that discussion, we want to throw up a really quick poll to hear from you. If you're going to be able to join us, what you would like to either share during this conversation or what you would like to learn more about in the conversation. So I'll give you all a moment on that. And we've got folks voting. Thank you so much. And we want to just, as you're doing that, I want to give a hearty thanks to Rowena and Helene for sharing your racial equity journey with us. You have given us so much to chew on, so many insights, and I'm really grateful for you. Thank you so much for being with us. And Shauna, I want to also thank you so much for introducing us to the Government Alliance on Race and Equity, and sharing your expertise and the resources that you have to share with the folks with us today in the audience. So we want to just thank you so much for partnering with us and being here today. It's been an honor to have all of you with us.
My pleasure.
Thank you. And thanks to all of you for spending time with us today. If you are able to join us in the discussion group, here are some ideas of what we may be talking about. Looks like folks are interested in talking about the government's role in advancing racial equity, as well as this concept that Rowena and Helene have raised so beautifully about using a head and heart approach to explore racial equity with your community. So hopefully we can dig into that a bit more over in the discussion group. And so with that, we will start to close out the webinar and invite you to join us over in that discussion group. Thank you so much. Allie, Raquel, James, thank you for your support, and we'll see you in the next room.